a line, 'cause it shouldn't hurt to smile when your bite is a
pain in my face and jaw on the right side.
Okay.
Okay, so I had a crown sometime late spring, early summer this year on the last tooth.
The last tooth?
Upper right.
Okay.
And then it seemed to get better. And then August 10th, I remember the exact moment I started to have a toothache again on that same side. Just took ibuprofen, thought that it would go away. So a week after that, I was still having issues. So I went back to my dentist, who looked at it and decided I needed a root canal on that tooth. Went in for a root canal a week after that, and then the pain never went away. I called him over the weekend because it still was hurting, and into the next week, went back, and then he sent me to the oral surgeon, who then, I think a week after that, actually removed the tooth.
Okay, that whole time it was hurting?
Yes. Yes.
Okay.
And we tried it, actually, it might have been 2 weeks, because we actually tried a course of antibiotics when I was still having issues, and he thought, well, maybe it was very close to the sinus, I guess, when they did the root canal, and they were a little bit concerned.
Upper back tooth can be.
Yeah, and so then he was worried about maybe there was infection, maybe it had abscess, so he put me on a course of antibiotics.
This is Dr. Gake?
Dr. Gake, yeah.
Okay.
And then I went to the oral surgeon. So it might have been 2 weeks after the root canal.
So you had suffered for a while?
Surgeon, yeah. And then he looked at it and said, yeah, we need to remove the tooth. So we took the tooth out, and then I've just continued to have pain since then. Multiple follow-up visits between the two of them. Ended up with, you know, I did hydrocodone after the surgery, which didn't do anything, so I quit taking it. 800 milligram ibuprofen, which I was eating pretty consistently to try to decrease the inflammation and pain. We tried Valium, we tried Flexeril, we tried, I can't remember, it's another anti-inflammatory. I want to say it's another non-steroidal, but it was one I'd never heard of before. It was more long-acting that he thought might work better than ibuprofen. It did nothing.
You're a nurse. You heard a lot of these messages.
Yeah, and I have no idea. I've never heard of this drug.
Okay, but it's a non-steroidal.
Yeah. So the pain just never went away. So throughout another 2 to 3 week period, I kept following up with them saying, this is still really bad. This hurts really bad. It feels like, so it's different than the dental pain. Like the tooth hurts. It's anywhere from here to here. Over the past even couple of months since kind of all this has gone on, I don't know if it was exactly the same then. I know there was a lot of, felt like sharp throbbing pain. Now it's very specific. It can go all the way up into here, all the way down here. It's the upper and lower. It may start out with one and then it's the other. It's a very like electric shock into my teeth. Feels like one tooth, or then all the teeth are hurting. The side of my face will hurt to the touch. So like right now, it doesn't really hurt to palpate, but when this is happening, it's excruciating to even push on it or palpate it at all.
Do you have to?
Usually, I haven't done anything. I mean, I might be chewing. I don't know. I don't really know what's causing it or when it starts, but what I find myself doing is that I'm doing this all the time. I'm pushing back. So when it's happening and I'm hurting, my response is to try to like push it back, rub it out, do something, which really doesn't do anything at all. But that seems to be, I catch myself doing that constantly, is trying to like push back or try to rub if I feel like there's a knot. So we kind of went back and forth between, is it muscle, is it the nerve, you know, what's going on? So that's why we went through some different meds. And we tried mouth guards. So I got a full bottom mouth guard and an NTI bite block.
You had them prior to it or
no.
after?
So
this?
the oral surgeon, after about 2 weeks, I think, after it wasn't getting any better, after the tooth removal, he sent me back to Dr. Geik and said, I want you to get these 2 mouth guards and see if that helps. 2 weeks after you have those, if it's not better, I'll send you on to you. So
okay, so they tried everything.
Yeah, they did.
Muscle relaxer, pain medicine, anti-inflammatory, mouth guard, the deprogrammer.
Yeah, benzos, and we tried Valium to see if it was, you know. So we've tried, I feel like, a ton of stuff.
Okay.
And it's never gotten any better, and at times it's even worse than it ever was.
Okay.
Yeah, I feel like it was more of a throb. It's hard now. I feel like I'm so hypersensitive to it that it's easier for me to describe exactly what it was because I'm more in tune to it. I think when it first started, I was kind of like, oh, it's another toothache. I feel more like it was a sharper throb, but not like the electric shock.
But you could kind of ignore and go about your life.
Yes, I could take ibuprofen, 600 ibuprofen, and move on and not think about it for a few hours, and it wasn't a big deal.
Okay.
I feel like after the tooth removal.
Okay.
Because I kept thinking, well, maybe, you know, it has something, not that he did anything wrong with the tooth removal, but, you know, having my jaw open as much or having as much work done, or, you know, because it kind of didn't get to as bad as it is until after that.
Yeah, I'm guessing Dr. Lavicek was an MD DDS, so probably didn't take him too long to get it out.
No, a couple minutes.
Yeah, I mean,
yeah.
It's
very episodic. It happens. I can tell you that usually, although this has been better the last couple days, but usually when I wake up in the morning, so even with the NTI, they've adjusted it once, but when I wake up in the morning, my back teeth hit. It's a funny, like it's not quite right still, so it takes a few minutes to kind of get to where I can close my mouth the way that I'm normally.
So the back teeth are touching more than the
right side,
second back tooth, because last one is
yes,
gone.
Right. When I very first wake up in the morning and take the NTI out, that always hits. So he adjusted it, but it still does it.
Okay.
So if it's not hurting at that point, which it's usually not, it's usually okay, that just feels weird. But as soon as I go to brush my teeth, even if I haven't, and it's not, I initially thought maybe it was just the opening of my mouth, but it's not. It doesn't hurt until I'm actually brushing on that side of my mouth. And then it kind of usually starts either immediately or within about 5 minutes after that. A lot of times when I eat, if I chew something that's harder to chew, and I have to chew really hard, I don't eat anything over here. I haven't eaten over here in months. It's all on the left side, but this side will start and I'll get that shooting pain. There's times that it just happens for nothing. Yesterday, sitting in a meeting, driving home, it just all of a sudden is like an electric shock into, and it's usually the back teeth of the top or the bottom. It's always on the right side. And then it just kind of, and it will shoot, and it will, all of a sudden, it'll just be from all the way up here, all the way down through both. And this, it doesn't always get up all the way up by the joint, but the times that it's the worst, that I notice the highest intensity, it's all the way from up here by my ear, all the way down. And it's that sharp, it starts with that electric kind of shock feeling inside the teeth, the back teeth usually on the top. And
you feel like inside the nerve itself.
Yeah, and then all of a sudden, and then it's more of just a sharp throb. It'll kind of, and then I'll try to move my jaw, see if I can like move forward or to the side.
Do something.
Anything to relieve it, anything. And sometimes it gets better for like 5 seconds, and I hold my breath, and then it immediately hits again. So
how long do these episodes last?
feels like forever, but it's probably closer to probably 5 minutes, maybe 3 to 5 minutes would be my guess.
During this 5-minute period, is that when you even touching it is making it worse?
Yes, yeah. Anytime that it's sore, and it was to the point, one of the times I went back to Dr. Halchak and Dr. Gager, I'm like, when it's happening, to even take my tongue and push on the gum around any of these teeth hurts really bad. But as soon as the pain's gone, I could push, I could do anything and it wouldn't hurt. So it's literally just so for a while I thought, I had asked him, I'm like, is it a muscle spasm? Because it kind of has that, it hurts really bad when it's happening, and then when it's not happening, it doesn't hurt at all. But looking up kind of the trigeminal nerve and the path, it's almost identical. It starts right there and it goes, and then it branches to the upper and lower. And sometimes when I feel it and I start rubbing, because that's kind of my natural thing, is just to push on it or rub on it.
It's more of an impulse.
Yeah, it feels like there's kind of a knot sometimes that I feel like, and I sit and do both, and I'm like, okay, is there one over here, not over here? And I have no idea if there is or not. It's just...
Feels like it.
It does feel a lot.
Like a muscle going to a spasm, maybe?
Yeah.
Okay.
So sometimes it feels like it's deep. Like, I always describe nerve pain, from my interpretation, as a much deeper, more visceral pain than a muscle pain or something else.
That's that how it feels?
To me, and that's how it feels most of the time.
You mentioned trigeminal nerve already. Did anyone suggest trigeminal neuralgia?
He actually, I don't remember if he used the word, if he said the trigeminal nerve, but he did say, it was over the phone on a Saturday when I called him, and I was just like, I am absolutely...
This is Dr. Lavacek?
Dr. Lavacek.
Okay.
Like, I am completely miserable. I'd had the mouth guard for, I think, no, this is when he told me to go get the mouth guard.
Oh, okay.
And I said, he said, it would be really rare, but it could be, and I don't remember what all he said, but he kind of went into muscle and nerve and like, kind of the different...
Sometimes they use the term neuropathic pain, trigeminal nerve being the one that sometimes is labeled as trigeminal neuralgia. And I think I sent you a link to a video about a lady that sounded like to you.
Yeah, I was watching it and I was like, oh my gosh.
Oh, fancy.
The fact that she had gone through it much longer than I have and had made it to a few more physicians, it was almost identical.
She's from out of town too. She's from Sedalia.
Yeah, it was...
Took a while for her to find
her
us.
symptoms, I literally probably sat there with my mouth open because I was like, every symptom she said was almost identical to what I'm feeling.
Like fancy. Okay, all right.
When she talked about not being able to chew, she couldn't eat fried chicken, which was her favorite food. Certain foods that we either have to, I don't know if it's opening wider or if it's harder to chew or harder to bite it. It's just, you notice it with certain things.
Just functioning then.
Yes.
All right.
Just, yeah.
Got it.
So it started sitting in this meeting, and I do feel like now I notice that I am clenching sometimes when it's starting to hurt. I'll notice that I've been clenching because my teeth on both sides will hurt, and I kind of relax my jaw. And it doesn't really change anything until it's over, but I don't feel like I was clenching last night. Not that I always am aware of it, but we were sitting there and it just kind of started with the electric shock into, right now it seems like it's the upper that it tends to start with, but not always.
Okay.
And so I went ahead and took 800 of ibuprofen while I was sitting there. And then it just kind of continued, kind of not horrific. I didn't have to get up and leave. We were done with the meeting by like 11:15. I got in my car to drive home, and it just hit. And it's that just sharp, that like they described the electric shock. It's just that really sharp, jagged kind of shooting pain, and it always starts in the back teeth on the top or bottom.
Okay.
And then it kind of just progresses. I ended up taking a Flexeril during the drive home, hoping that maybe that would help. It seems to sometimes make it a little bit better. It doesn't ever completely relax things to make it go away. So that's the other reason that I wonder if it's really not totally muscle, if it is nerve, because the Flexeril doesn't always work.
Okay.
So anyway, drove home, it got a little bit better, and then walked in, it started again. I put my mouth guard in immediately, the NTI, because I thought maybe I could get it aligned a little better or something. That didn't help. Couldn't sleep because it hurt so bad. Tried an ice pack, and then would start to doze off and would wake up with a sharp shooting again. This probably went on for, I don't know, an hour and a half. This time kind of, it hit, and then it would stop and I could doze off, and then it would hit again and I would wake
you up again.
Yeah, and it was just, I mean, I was at the point where I was, it was funny because my mom was with my kids because my husband was out of town and I had to be here early before school. So I even was afraid I woke her up, because at one point I was like, oh, I was so frustrated because nothing was working. And it really did feel like I thought to myself, you know, I said I adjusted my pain scale to what really a 10 was. I literally thought to myself, okay, this is not 10, this is 15. Like, this is horrific. And the fact that you can't.
And you had babies
make
before.
It go away. Yeah.
So you know.
Yeah. I mean,
childbirth pain.
C-sections, but at least that operative pain. But yeah, it's horrible. And part of it is that you can't, with a lot of pain, you can do things to relieve it at least temporarily. This, nothing works. And when it's done, but nothing that I have found, whether it's pushing, whether it's moving, you know, my jaw, whether it's ice, whether it's heat, whether it's meds, nothing really makes it better or go away. It just, you literally have to wait it out, and it's excruciating in that time period until it stops.
So that's your number one issue. If you can find a solution for it, life would be better.
Oh my gosh. Yeah.
Okay.